I'll introduce him.
Okay.
Okay, welcome back, everybody. I need a motion to go back into open session, please.
I move that we go back into open session. Second.
First and second. Is there any discussion on the matter? Not hearing any, roll call, please.
Mr. Pig,
Yes.
Mr. Deal.
Yes.
Mrs. Adams. Dr. Henry. Ms. States.
Yes.
Okay, so I appreciate everybody's patience. We're under new business now. First on the agenda is act on recommendation to select and approve contract for the new wellness van bill. Parliament. To get your
Hi, good afternoon again. Hi, this is Jake Schwab. He is our supervisor for our community clinical services. So our mobile wellness team reports directly to him. And he's been very, very much involved in this bid process for the new wellness team. So in your packet, you should see a recommendation. It goes through what our total funding amount is that we have available for this bill. It goes through the bid proposal narrative that breaks down how we did the process and how we narrowed the bids. We did receive a total of 9 bids for this request. 8 bids were received within the required timeline, and were opened. 7 bids met the basic structural proposal expectations. And from there, we needed a little help because this is a big build. So we tapped a consultant to help us look at some of those things that we weren't as familiar with, like the chassis, like the generator, like you know, the heating and cooling systems, all of those things, the structure. So from there, then we got additional input from a consultant who works on these vehicles every single day. And that was extremely helpful. We were then able to narrow it to 3 bids after that consultant reviewed all of those bids. The 3 most favorable bids for the build are listed on the backside of that proposal. From that, then we had to look at our timeline. So because we do have grant funding for this build, we had to make sure that the build was going to meet our required timelines for when those funds are available. That narrowed the bids to 2 possible bids. So you'll notice on the back, the 2 that we're looking at, CT Coachworks and Craftsman. There were a lot of differences in how those were bid. Our recommendation is to award the bid to Craftsman based on the totality of the bid and it being within our current funding availability, as well as it being a local company. So that also weighed into it because they're in St. Charles. The other company was across the US. So we did not get exact dollars for all of those costs that would be incurred for training, for delivery, and things like that. So our recommendation then is to accept the bid from Craftsman not to exceed the total funding amount, which is listed there as $493,034.85. Questions?
Dave, you have a question?
No, sir.
Did you want to be?
Is this one of the companies that was in the thing that you guys went to?
Yeah.
Yeah, we figured.
Well, actually, most of these, that's how we got
Right.
the bids. Were the mobile healthcare conference that we
Yeah.
go to every year, is a national conference. And so, we were able to tour a bunch of, the vans from these vendors while we were there.
What's the primary use of this van?
So our,
Rental?
Nope, our mobile healthcare team, our nurse practitioner and the team that does primary care directly in the community. They've been, since our other van, has been sold and is not used, became unusable. They have been using one of the Sprinter vans. The problem with that is there's nowhere for a patient, there's no patient exam room, there's no bathroom.
They're just getting out there, but not able.
They're getting out there, but they're having to have a lot of the patients come back to office settings if they need to get a urine sample, if they need to do full exams and have the patient lay down, because they can't do that in that type of setting. So we do have multiple funding sources here. This is, you remember, we talked about the Jefferson Foundation capital grant that we were awarded, so that's a portion of it. We also received funding through the expanded lab capacity contract with the state. We also have funding from the sale of the previous vehicle and our insurance payment from the accident.
Questions?
So, excuse me, does this include any, warranty? I'm saying.
How big is it? One, sorry,
33 feet.
It's on-
I never could find the page, so I just have notes.
Any, advertising, not advertising, but stuff on there?
Graphics?
Yeah.
Yes, it does.
Thank you.
Yep.
Comes with all that.
Yep.
I know, I was like.
Is it on there somewhere?
Yeah, it is.
Did I miss it?
Gonna be wrapped.
Little
possibly,
graphics
Yeah.
included.
Wrapped with photos and.
Oh, I see, okay.
It's under the vehicle specs.
I see, okay, I'm sorry.
So I know they did a lot of work on reviewing this and, you know, they did a lot of due diligence and didn't just settle for, you know, the lowest bid. They got the things they needed to make it right and to make it local, which is kind of one of my things. I'd like to be able to get somebody eye to eye if I need to. And I don't
So it's
have to
gonna
go
be
all
a
the way out
preference for
someplace
a good
else and, you know, Minnesota or California or anywhere else to look at somebody. Any other questions?
One last question. What did the last one that we did cost us?
The last one wasn't new. The last mobile wellness vehicle was used.
Mhm.
And I don't know what that actually cost us.
Well, it was in Houston, and I don't remember.
You guys had to go pick up, you and Mr. Tuck. had to
Road trip.
pick that
Yeah.
up.
Broke down all the way back.
You're on the back.
And I wanna think that was, memory serves me as like 280 or 300,000.
don't remember.
That's my memory.
I don't know.
Could be
I
a, could
apologize.
be a false memory. But... All right, is there anything else? Any other questions? Thank you for that, presentation. So I am going to ask, for a motion to approve. Craftsman,
I move that we approve, that van,
that's
With the
the,
new person, baby.
new wellness van, bill,
for 400 and what was the total dollar?
whatever Melissa said.
34.
493. So I have a first, do I have a second?
Yes.
Have a first and second, is there any further discussion on the matter?
This is, in one place here, it says 44.3, and then
On the back page,
is, so what's the final?
493.
Where do you?
oh, this is not to.
We need the dollar amount.
He's looking out at Crest.
484.
Yeah.
443.
So that is with the options that they provided. We do have funding amount in the amount of 493,034,85. So we could, you know, depending on, and this bid was only good for a certain period of time too, so I want to make sure that we have all of those bases covered because our funding amount is pretty close to the actual bid amount, so.
Again, thank you for that explanation. So we have a first and second for not to exceed amounts
Of the funding.
of the dollars of whatever. Oh, no, it was good. 493,034. We have first and second. There's any further discussion. Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Go get yourself a bag.
Good job, guys.
The next on the agenda is Act on recommendation to authorize dealer to request bids for our furniture purchase for the new Hillsborough building.
I move on acting on the request for the dealer bids for furniture purchase for the new Hillsborough building.
Right, so first, do we have a second?
Second.
First and second, is there any discussion on this motion?
Mr. Chairman,
Yes, ma'am?
one thing I would want to say would be, I think that we should take as much of this as we can. It looks like good stuff. And we should only buy what is necessary, maybe for the, where you first come in and things like that, that's all gonna be. We don't need chairs, we need maybe beautiful couches or something like that. Vinyl.
I believe some of the furniture will be, and some of it's not gonna be able to, and Mr. Sykes in that process, along with everybody else looking into
Yes.
the things, yes,
People
you are correct.
want it to be
But
nice.
then the other, any of the furniture we do have left over, we will be selling. So anyway, maybe first, second. Any other discussion on the matter? Not hearing any, all in favor, please say aye. Any opposed? All right, motion carries. Next one, act on recommendation to approve the MOU with Chestnut. Do we have any, I'd like to talk about that a little bit, I believe.
Y'all are gonna get tired of me today.
That's all right, you're fine. I really have the information out, so we're all having.
So you have in your packet the MOU with Chestnut. So I just wanted to explain to you what this is and why I feel it's important. They approached us back in, I think it was started in November of last year. Chestnut received a mental health board year-long grant that allows them to help provide not only mental health support, but resource navigation directly in the community. And we have been trying to hire and connect with resource navigation. We tried to hire a social worker in the past 3 years. We just haven't had the right structure and the right connections under our umbrella to create a lasting position. So when they approached us, we really have a need, our patients have a need while they're in our doors to be able to get connected with mental health resources, with food resources, with housing resources, with ways to apply for Medicaid. We just have not had that structure to be able to handle that. So Chestnut with this MOU is providing a community health navigator to work directly with Jefferson County Health Department. And they have the resources, they have the background, they have the structure to be able to support that position. So it'll be their employee, no out-of-pocket dollars. What they have asked for is a space, even a landing space within our office setting.
Okay.
And Wi-Fi access.
Okay.
They're gonna start working here in Hillsborough if you guys approve this. And also with our mobile wellness team, because when they're out in the community at food pantries and different locations in the community, they also see a need to help connect our patients with needed resources.
Perfect. And what's MOU stand for?
Memorandum of Understanding.
Okay.
More than a handshake, less than a contract.
Yep.
I do have something to ask. Are we there yet?
Please, go ahead.
Isn't that what Aspen was supposed to be doing?
So Aspen is a database that allows us to see resources. So it is one tool that we use. We can give that resource to patients and say, hey, go on here and check this out. And if you want to find, this, it's not, it definitely helps connect patients with those resources. It doesn't necessarily help them apply for Medicaid. It doesn't always help with that direct handoff when they're in our door. We don't know that when they walk away, if how much they're able to use. We definitely provide those resources in writing and those connections when they're here. This is just one more layer to help.
It's a person that will actually work with that client.
Mhm.
and say, you know,
Didn't ask when we go for.
Leave the-
schools also.
Actually, the resources, like, you can access that, yeah. Like, if you want to see who, primary care providers or mental health providers, our staff can access that.
sure, can I ask you one more question?
Yeah.
You're talking about Chestnut, so I had heard that Chestnut was Compass now. Is there still two entities or?
Chestnut is not Compass, no. Palm Tree and Compass merged.
Oh, okay, okay.
Any further?
Yes. So,
Come on, nurse.
yeah, so I remember when we were closing out the Aspen. That Ms. Brown was wanting a space in our building too. Is that?
They no longer have a space in our building that I'm aware of.
No.
I know they
Aspen.
had asked for,
Aspen does not have a space.
he wanted to work out of.
Where does Aspen reside?
Four.
They did for a little while, but
Okay.
they do not have a space there.
So are we still referring people to them, or I guess,
Yeah.
I know there was so much time, so much money, so much effort on that, and now it seems like they're gone, now we're having to bring somebody in on.
No,
something.
I apologize. That is not the intent. Part of this MOU with Aspen is, or with, I'm sorry, Chestnut, is they also will be working with Aspen to educate that community health worker on ways to use Aspen, that database, to be able to help connect our clients and our patients with those resources. Right now, our nurses have limited time to be able to create
Right.
those connections. We
All those
can-
other things.
Yeah. It is more of a very warm handoff. It also can help our staff learn a little bit more about how to use Aspen too. If we have a Chestnut community health worker that is actively using it on a daily basis. It's just a collaboration with folks that are agencies that are already in the community.
Yeah, Chestnut approached us.
They did.
It's,
Yeah.
by the way, and then with an MOU, the difference between that and a contract is it's not a fee for service type of a situation, like they're wanting to have access to space. It's a way to also share patient information so that whenever, we have HIPAA protected information, so whenever we have this MOU, they're bound by the same conditions that we are and vice versa, so we can share that information back and forth. But it's not, they're not providing a fee for service to us.
So they just want space.
They want space and access. Space and access to the same people that we service and the same information that we get, so they can provide that service to people and vice versa.
And we have a way to do that within our electronic medical record system to provide a referral and meet all those compliance requirements.
There's a lot of people out there who need that. Yeah, I'm like,
Okay. Just in case you want to look at it, like I said, there are no.
Who are they gonna be assigned to, or who's gonna supervise?
Chestnut, so it is a Chestnut employee, this individual. They'll be working directly with me to try and make sure they get the right assignments connected to the right folks within our agency. But they are a Chestnut employee, they're not our employee.
This MOU, do we have to do a BAA?
We also have to do a BAA. And that's our standard BAA for sharing information and coverage. for HIPAA.
What's the acronym stand for?
Business associate agreement.
Thank you. Just so everybody is.
And that's
You fill it
required by
around.
HIPAA
Sure.
for any covered entity to be able to, even if we're referring to another entity that's also covered by HIPAA, in order for us to make sure that, we're all in compliance with those guidelines, the BAA does that.
And just because you're a HIPAA covered entity and you have the right to have that information on your own, and so do I don't have a right to give it to you unless there's a BAA. And vice versa, I don't have the right to receive it. unless there's BAA.
Any other question?
this is all health services or just mental health?
It's more than mental health services, so it's a health navigation, so they will connect us, our patients with mental health services, and we do struggle a little bit with that whenever folks are in the door, but it's also those other resources that, you know, we identify when they're in our door and they need help with domestic abuse or, you know, other situations that we do our best, but we're not necessarily the experts.
So this is dated February 22nd, is that when it starts?
Actually, if you agree today, is today the 22nd?
Yeah.
Yes.
That'd be.
That would be today.
But they have somebody ready to go?
They have someone who is ready to go as of Monday.
And where are you gonna put them? We have
We're
an office.
figuring that out.
Well, we have
We're
an
figuring
office
that
now. Steve moves in to Kelly's and then just needs. I'm just saying.
Davis, inappropriate.
We got,
Please,
What?
we got.
thank you. All right, is there any other questions? All right, thank you very much. So on the table, we needed a motion to act on recommendation to approve the MOU with Chestnut. Do I have a motion?
We have
So,
a motion, we were discussing it. Oh, okay.
so
We have a
moved.
motion.
Do I need to repeat that all of that? Or just say
Just
so
the
moved?
MOU with Chestnut.
Move that we approve the MOU with Chestnut Health System.
Second,
Having first, second, is there any further discussion? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Okay, the next is act on recommendation to form a standing committee under the bylaws, namely the legal committee for communications between same and council regarding privileged communications advising the departments. We had discussions with this, in the executive session. Do I have a motion for such?
And motion that we have a legal committee.
Do I have a second?
Second.
Having first and second, is there any discussion for such?
Mr. Chairman,
Yes, ma'am.
I don't believe this is necessary. I think that, everything that we need to discuss that's not privy to the public, we should do it in a closed session. And all the members should be present
Okay.
for all of this.
Is there any other discussion on the matter?
And we were gonna fold the litigation committee.
That's basically what is, the litigation is
Into
gonna
that.
become the legal committee.
Right, litigation is a special,
That was a
currently disbanded.
temporary-
But we won't need.
Fold that
we
in.
won't need to have both.
Okay.
All right, any other discussion on the matter? Not hearing any, all in favor, please say aye. Aye.
Aye.
Any opposed?
That would be me. No,
Thank you, I knew it was. All right, I understand. All right, the next one, I'm trying to read this and not make too many mistakes. Appreciate the attorney's assistance with this. So the next one is to act on a recommendation from the personnel committee to appoint an interim director, as we discussed with inside our executive committee, including a salary adjustment during this time. And that at such time when if and when the interim is no longer in that role, that person will revert back to their current position.
Good job.
Did I say that pretty well? Okay, nobody else has to repeat that. I just need a first,
So moved.
first motion,
a motion. Do I have a motion?
Yes.
And I have a second?
yes, second.
All right. Having a first and second, is there any just light discussion over this, because we extensively discussed this in our executive, so be very cautious about what we discuss. Not hearing any, I'm gonna ask for a roll call vote.
Mr. Pig,
Yes,
Mr. Deal,
Yes.
Ms. Stidham,
Yes.
Dr. Henry, and Ms. Davis.
Yes,
motion carries. That'll be disseminated later. All right. Next one is, this is gonna take a little explanation too, is act on easement for Ameren. When in your package, you have something that looks like an easement for Ameren. That's not the easement. We're having issues, with Ameren, as I tell you, and if there's somebody from Ameren watching, you know the guys are bad. But about getting things done. So what I'm gonna ask the board to do is give me authorization to sign this easement when it gets completed properly. What we're having a hard time doing is getting it done to where it's not under our building. We can't have an easement under a building for any such matter. So, and I'm working with we're working with the architect, we're working with the building, but in an effort to make sure we don't delay it, because that's part of the issue that we'll need to move forward. I'm asking the board to give me that authorization to make sure that we can sign this agreement, this easement, and it has to be the chairman to sign it in the future. I'm hoping it'll be done before.
Yeah, I'd sent it to Jim. I hadn't heard back.
I mean, they sent one, but we don't think it's right. So in an effort to streamline the building process and not to delay it, that's what I'm asking for. So I guess the motion is to allow the chair to sign the proper easement agreement as is reviewed by our architect. And
Do we probably need to send it back?
Yeah.
and
She approved the first
our,
one.
our attorney to make sure everything's proper. So I have a first on that motion.
I'll make a motion for the children to deal with the Ameren.
I've been just like
Sign
that.
it, sign it.
I
Sign
dubbed
the
the
easement agreement, right? Second.
Second.
All right, first and second, is there any discussion on the matter? Not hearing any,
Does this have to be done just because there's a change, or does that?
there's no easement.
There was no easement.
All right, so having a, is there any other discussion? All right, having a first and second, all in favor, please say aye.
Aye.
Any opposed? Thank you, motion carries. Next on our agenda is entertaining topics for the next agenda. Does anybody have any topics?
We need a committee, or we need, to interview attorneys. Right,
That will be part of the legal committee's job to do.
so what, legal committee?
That'll be theirs to get everything set up. So,
But we need to know, or can we make recommendations, or should we be looking?
sure, you can make recommendations.
Okay. What else?
Okay. Not hearing any further, I'm gonna ask for an adjournment.
I move that we adjourn.
Thank you.
Second.
Okay, for a second, all in favor, please say aye.
Aye.
Aye.